The hospitals are full and the truly sick keep on arriving. The only sound is the urgent movement of the medical teams and the machines keeping the patients alive. Desperately ill, each breath is a struggle. This is the reality of the deepening crisis Spain is facing. Many of the patients are unconscious. They're turned on their front to improve their chances of survival.
When they were having difficulties to breathe and this shortness of breath, this is one of the first steps that we take, and doing that the blood oxygen improves, and that's a first step to at least to make it go slower.
In each bed, the battle for life is played out. Lonely wars with no loved ones by the bedside. The infectiousness of the novel coronavirus makes sure of that. Doctors do their best, but even something as simple as the human touch is difficult in these conditions.
If you need all these clothes for management the patients, if you need intubated, if you need put a catheter, if you need very maneuvers, complicated maneuvers, it's very, very difficult to work on these clothes.
Spain watched in horror at what was happening in Italy, but is now following in that country's footsteps. In fact, the outbreak may soon be even worse. Already, more people are infected with the coronavirus.
When you come to these wards, you understand, when you look at the patients in intensive care, just how overwhelmed the healthcare system in this country has been. Day after day, patient after patient, they just keep on coming. And to give you an idea of how bad it is, at this hospital, more than 75% of the patients now are COVID-19. The majority of the hospital's capacity is now dealing with the coronavirus.
The doctors liken what's happening here to a natural disaster, but one which does not stop.
One entire month, every day coming 60, 70 patients with severe conditions. Every doctor here, even the surgeons, the urologists, the ophthalmologists have been taking care of medical patients, respiratory patients, which is very unusual. Even students, medical students in the last year of their careers have been recruited to take care of these patients.
A good outcome is down to the skill of the clinicians, but they also admit that when dealing with a virus that was unknown to the world just a few months ago, luck also plays its part. Adria is lucky. He came here gasping for air, but is now recovering.
I come to the hospital, and once I enter the hospital, I didn't remember what happened until this is my third week here. So, but now it's fine.
Doctors say this nation, like nearly everywhere else in Europe, was ill-prepared for the enormity of this crisis. There is a shortage of protective clothing, and as for beds, even sports halls are being converted into wards. The warning here is about ending the lockdown too soon. Overwhelmed, the medics fear this could just be the beginning, and a second outbreak could be even more devastating. Alex Rossi, Sky News.